Hives are an intensely itchy rash, generally raised and red, that comes and goes over time. And you can have acute hives, where hives will come for a few hours and then go away and not come back, or chronic hives, which by definition are daily or almost daily for at least 6 weeks, and sometimes up to years even. Hives they're generally red, raised, itchy, and they can be pinpoint or more commonly look like a welt, sort of more like a mosquito bite appearance. And they should not leave behind a mark or a bruise. If a hive is leaving behind a mark, then that's something to mention to a physician. Acute hives, which generally come or go within a day or a few days, are most commonly a result of an allergic exposure. And so generally the most important thing will be the clinical history. So the questions we ask and the clues that a patient gives us helps us determine what might have caused the hives as part of an allergic reaction. Chronic hives, on the other hand, which generally last for 6 weeks or longer, don't usually have a secondary cause. But we will do some basic testing just to rule out anything serious as a secondary cause for the hives. Mainstay of hive treatment is going to be oral antihistamines, some of which are available over the counter and some of which are by prescription. There are 2 different kinds of antihistamines. So there's going to be the short-acting, more potent antihistamine, which is oftentimes the one that makes you very drowsy, so it has more side effects. And then the longer-acting antihistamine that stays in your system longer, may not be quite as potent, but can have more of an effect for longer. If antihistamines are not enough, then generally I would talk to a physician about other options, and we have many immunomodulators and immune suppressants that can calm the immune system so that that revved up immune system causing the hives can be more calm. In addition, if we find an acute cause for the hives, then we'll generally advise avoidance.